If you're afraid of bunion surgery, you're not alone. In fact, most of my patients wait far longer than they should to consider surgical treatment because of fear, misconceptions, or hoping their bunion will somehow get better on its own. I understand the hesitation. The thought of someone operating on your foot, the recovery time, the potential complications, these are all legitimate concerns. But what many people don't realize is that modern bunion surgery has evolved dramatically over the past decade. Today's procedures are more precise, recovery times are often shorter, and success rates are higher than ever before. My name is Dr. Andrew Schneider, and I'm a podiatrist in Houston, Texas. Over my 25 years of practice, I performed hundreds of bunion surgeries and helped patients overcome their fears to achieve life-changing results. Today, I want to clear up the misconceptions about bunion surgery and give you the facts that you need to make an informed decision. Our previous modules in this Bunion 101 series, we covered what bunions are, how they affect your life, and the non-surgical treatments available. Today we're discussing surgical solutions, when they're necessary, what your options are, and what you can realistically expect from the process. Before we start, please like this video and subscribe with the notification bell on. This information can help someone you know who's been suffering with bunion pain and avoiding the treatment they need. And don't forget to get your free copy of my comprehensive bunion book at www.bunionbook.com. Let me start by addressing the biggest misconception about bunion surgery, that it should be your last resort, something you only consider when you absolutely can't stand the pain anymore. This outdated thinking actually leads to worse outcomes because severely deformed arthritic bunions are much more challenging to treat successfully than moderate bunions caught at the right time. The truth is, bunion surgery should be considered when conservative treatments haven't provided adequate relief and your bunion is significantly impacting your quality of life. You don't have to wait until you're in agony or completely unable to wear shoes. So who's a good candidate for bunion surgery? The decision isn't based solely on how your bunion looks or even how much it hurts. It's based on how it's affecting your life and on whether non-surgical treatments have given you the relief you need. You might be a candidate for bunion surgery if you've tried appropriate conservative treatments for at least 3 to 6 months without adequate improvement. This includes custom orthotics, proper footwear, activity modifications, and possibly injection therapy or physical therapy. Surgery may be appropriate if your bunion pain significantly limits your daily activities, work, or exercise routine. If you can't find shoes that fit comfortably, if you're avoiding activities you enjoy, or if the pain is affecting your sleep or overall quality of life, surgical correction might be the best option. Progressive worsening of the deformity despite conservative treatments is another indication for surgery. If your bunion continues to get larger and more painful, even with proper treatment, surgery can halt this progression and provide long-term relief. The development of secondary problems like severe hammer toes, chronic calluses, or arthritis in the big toe joint may also indicate that surgical intervention is needed to prevent further complications. However, surgery isn't right for everyone. Patients with certain medical conditions that increase surgical risks, those who can't commit to the postoperative restrictions, or people whose bunions aren't causing significant functional problems might be better served with continued conservative treatment. Now let's discuss the different surgical options available. The type of procedure recommended depends on the severity of your bunion, the condition of your joint, your age, your activity level, and other individual factors. Traditional bunionectomy, also called an osteotomy, has been the gold standard for bunion correction for many years. This procedure involves making a cut in the metatarsal bone, realigning it to a more normal position, and securing it with screws or other hardware. There are several variations of this procedure depending on where the cut is made. For mild to moderate bunions, the cut is typically made near the head of the metatarsal bone. For more severe bunions, the cut might be made at the base of the bone near the midfoot. The advantage of a traditional bunionectomy is that it's a well-established procedure with predictable results when performed correctly. The recovery typically involves 6 to 8 weeks in a surgical shoe or boot, with gradual return to normal activity over 3 to 4 months. However, traditional bunionectomy addresses the bunion in only two dimensions. It moves the bone over and removes the bump. It doesn't address the rotation of the bone or the instability of the joint that caused the bunion in the first place. This is why some bunions can recur after traditional surgery. Lapiplasty represents a revolutionary advance in bunion surgery. The procedure addresses the bunion deformity in all three dimensions, correcting not just the sideways deviation of the bone, but also its rotation and elevation. More importantly, it stabilizes the unstable joint that's the root cause of most bunions. Here's what makes Lapiplasty different. Instead of just cutting and moving the metatarsal bone, the procedure fuses the unstable joint in the midfoot that allowed the bunion to develop in the first place. This provides a stable foundation that prevents the bunion from recurring. The procedure uses specialized instrumentation to precisely rotate and realign the entire metatarsal bone back to its normal anatomical position. Then, titanium plates are used to permanently secure the correction, providing much more stability than traditional single screw fixation. One of the biggest advantages of Lapiplasty is that patients can often begin walking within days after surgery, rather than weeks. The advanced fixation techniques provide such stable correction that early weight bearing won't compromise the results. Recovery from Lapiplasty is often faster and more predictable than traditional bunion surgery. Most patients can return to regular shoes around 6 weeks and full activity by 3 to 4 months. The recurrence rate is also significantly lower because the procedure addresses the root cause of the bunion. However, Lapiplasty isn't appropriate for every bunion. It works best for bunions caused by instability of the midfoot joint, which represents the majority of cases, but some bunions are better treated with other procedures. Minimally invasive bunion surgery is another recent advancement that's changing how we approach bunion correction. This technique uses much smaller incisions and specialized instruments to perform the bone cuts and realignment. The advantages of minimally invasive surgery include smaller scars, less soft tissue trauma, reduced postoperative pain, and often faster recovery. Some patients can return to regular shoes in as little as 2 to 3 weeks. However, minimally invasive techniques require specialized training that aren't appropriate for all types of bunions. Severe deformities or bunions with significant arthritis might still require traditional open surgery for optimal correction. The key is working with a surgeon who has experience with multiple techniques and can recommend the best approach for your specific situation rather than just using a one-size-fits-all approach. Let me walk you through what you can expect if you decide to proceed with bunion surgery. Understanding the process can help reduce anxiety and ensure that you're properly prepared. Pre-surgical planning begins with a thorough evaluation including x-rays and possibly other imaging studies. We'll discuss your goals, expectations, and other concerns you have. You'll receive detailed instructions about preparing this for surgery, including any medications to avoid and arrangements you need to make for transportation and recovery. On the day of surgery, bunion procedures are typically performed as outpatient surgery, meaning you go home the same day. The surgery usually takes about an hour to an hour and a half, depending on the complexity of your case. Most bunion surgery is performed under general anesthesia. A local block numbs your foot and ankle, but you'll have a restful, painless sleep. After surgery, your foot will be wrapped in a protective dressing and you'll be given a surgical shoe or boot to wear. You'll receive detailed post-operative instructions and pain medicine to keep you comfortable during the initial recovery period. The recovery timeline varies depending on the procedure performed, but here's what you could generally expect. For the first few days after surgery, you need to keep your foot elevated as much as possible and limit your walking to essential activities only. During the first 2 weeks, you'll return to the office for wound checks and dressing changes. Most patients can return to desk work during this period if they can keep their foot elevated and limit walking. Around 2 weeks, the stitches are typically removed and you'll transition to a more comfortable post-operative shoe. If you've had Lapiplasty or certain other procedures, you may be able to begin walking normally in the surgical boot at this point. Between 6 and 8 weeks, most people can transition back into their regular shoes, starting with athletic shoes or other supportive footwear. Return to dress shoes, high heels, or narrow shoes typically takes longer. Full recovery, including return to all activities and sports, usually occurs between 3 and 6 months after surgery, depending on the procedure performed and your individual healing rate. It's important to understand that bunion surgery recovery requires patience and compliance with postoperative instructions. Trying to do too much too soon can compromise your results and potentially lead to complications. Let's talk about success rates and what factors influence outcome. Modern bunion surgery has very high success rates while performed appropriately, with most studies showing satisfaction rates above 90%. However, success depends on several factors. The most important is having realistic expectations. Bunion surgery is performed to relieve pain and improve function, not primarily for cosmetic reasons. While most patients are happy with how their foot looks after surgery, the primary goal is getting you back to comfortable, pain-free activity. Compliance with postoperative instructions is crucial for optimal outcomes. This includes wearing the prescribed footwear, limiting activity as directed, attending all follow-up appointments, and gradually returning to normal activity according to your surgeon's timeline. The severity of your bunion and the condition of your joint also affects outcomes. Mild to moderate bunions with healthy joint surfaces typically have better results than severely arthritic bunions that have been neglected for years. Your overall health, age, and activity level also play roles in recovery and outcomes. Younger, healthy patients typically heal faster and have fewer complications than older patients with multiple medical conditions. Choosing an experienced surgeon who performs bunion surgery regularly, stays current with the latest techniques, is also important for optimal results. Complications from bunion surgery are also relatively uncommon, but it's important to understand the potential risks. These can include infection, delayed healing, nerve injury, recurrence of the bunion, overcorrection or undercorrection, and stiffness of the big toe joint. The risk of this serious complication is low when the surgery is performed by an experienced surgeon and post-operative instructions are followed carefully. Most complications, if they occur, are minor and they can be successfully treated. One of the most common concerns patients have is whether the bunion can come back after surgery. While recurrence is possible, it's relatively uncommon when the surgery is performed correctly and addresses the underlying cause of the bunion. This is one reason why procedures like Lapiplasty, which addresses the root cause of the bunion, have lower recurrence rates than traditional procedures that only address the visible deformity. The decision to have bunion surgery is personal and should be based on how your bunion is affecting your life, not just how it looks or what others will think you should do. Some people with severe-looking bunions function well and don't need surgery, while others with moderate bunions may benefit significantly from surgical correction. The key is working with an experienced podiatrist who can evaluate your specific situation, discuss your options, and help you make an informed decision that's right for your lifestyle and goals. If you've been putting off addressing your bunion because of fear or misconceptions about surgery, I encourage you to at least have a consultation to learn about your options. You're not committing to surgery by having an evaluation. You're simply gathering the information you need to make the best decision for your situation. Modern bunion surgery offers excellent outcomes for appropriately selected patients. The procedures are more precise, recovery time are more often shorter, and success rates are higher than ever before. While surgery isn't right for everyone, it can be life-changing for people whose bunions are significantly impacting the quality of life. Before we wrap up, I want to hear from you. Leave a comment below and tell me what's your biggest fear about bunion surgery. Is it the pain, the recovery time, or something else? Understanding these concerns help me address them in future content. If this series has been helpful, please share these videos on social media. Someone you know might be suffering with bunion pain and not realize that effective treatments are available. Don't forget to get your free copy of my comprehensive bunion book at www.bunionbook.com. It provides detailed information about everything we've covered in this series and can serve as a valuable reference as you consider your treatment options. If you're ready to take the next step in addressing your bunions, whether that's exploring conservative treatments or learning about surgical options. Don't wait for the problem to get worse. Schedule a consultation to discuss your specific situation and develop a personalized treatment plan. Early intervention always provides the best outcomes. The link to schedule is in the description below. Thanks for watching this Bunions 101 series. Make sure to subscribe and hit the notification bell for more important foot health content. Remember, you don't have to live with bunion pain and limitations. Effective treatments are available, and the sooner you address the problem, the more options you'll have and the better your outcomes will be. Take care of your feet. They carry you through life. Thanks so much for watching, and have a great day.